Welcome to Effective Interventions in Caring for Persons Who Have Behavioral Expressions, a Frontline Forces training presented by Superior Health Quality Alliance, or Superior Health. This is the second Behavioral Interventions module. In this module, we will explore interventions to use when caring for people with behavioral expressions. This is the second Behavioral Interventions module. The information contained in this module is relevant for nursing assistants who are on the front lines of providing care for patients, for anyone providing care to an older adult in any caregiving capacity, and even for those not in a caregiving capacity who are looking for ways to improve their knowledge and understanding. The purpose of this series is to provide basic education about dementia and suggested interventions for dealing with people with behavioral expressions. It is not necessary to complete this entire series in one sitting. You can leave and return to the course at any time. Our objectives in this module are to understand the cause of behavioral expressions, to anticipate how dementia can impact behavioral expressions, and to learn the acknowledge, affirm, redirect approach for behavioral expressions. Here is a summary of what you learned in Module 1. Dementia is a general term used to describe memory loss. Dementia is not a normal part of aging. Alzheimer's is the most common form of dementia. Behaviors can be very challenging and can be a sign of an unmet need that the person may be experiencing and cannot verbalize. Providing support, offering dignity, promoting comfort, and giving appropriate redirection can be helpful interventions that can help in reducing behaviors. Behavioral expressions, once termed behaviors, are an expression of a person's unmet want or need. An example of an unmet want or need might be that they are hungry, or perhaps in pain, or do they have to go to the bathroom? It should be noted that agitation occurs in 75% of people with dementia. Memory problems produce common symptoms like repetitive questions, disorientation, and failure to follow directions. Dementia residents become frustrated as they struggle to find the right word. This is because the human brain stores images of faces, objects, animals, plants, etc., and compares those images to what you see and what you know. Dementia will erase these stored images. Residents may also lose the recognition of touch and smell. There are many types of behavioral expressions. This list describes many of them, but is not all-inclusive. If a person is exhibiting a behavior that they haven't before, you should always try to think of what unmet want or need they are trying to communicate. People who have behavioral expressions deserve to be supported and treated with dignity. In order to keep the person and yourself as safe as possible, it may be necessary to have help when trying to meet their unmet needs. Other first-line interventions are things like reducing noise, distraction techniques, modifying the task that they are working on, and assisting them with focusing. Helpful strategies that can be used at the time of the behavior are to acknowledge, affirm, and redirect. Acknowledge what the person said, affirm the truth of what has just been said, and redirect the person so that they change their focus. Trying to reason with the person has no value. Redirecting their attention to something else is a positive response. In the acknowledge phase, you are repeating back what you heard the person say. This lets the person know that you are trying to understand what they are asking or telling you. For example, I hear you say that you think someone is trying to steal from you. In the affirm phase, you are not saying what they said is not indeed true, but are offering up what another alternative might be. This strategy is also helpful if the resident is expressing anger or accusing the caretaker of something that is not true. For example, I guess that could have happened, but the people here are here to care for you, and they care about you very much. Redirecting brings their attention to something else. This is a positive response. Will this approach work all of the time? No, but it's worth trying to be able to calm the person down before they become more agitated. These bullet points from Dr. Gary Chapman describe how hard these interventions can be. It is oftentimes easier said than done. Understand that the resident is not responding that way on purpose, so you don't take it personally. It is more helpful if you can stay calm. The battle and the victory is often in your own mind. It's best to acknowledge what happened rather than ignoring it. And it's best to redirect if you can, refocusing their attention. Remember, even with practice, you can only do the best you can do and not better. You're only human. You'll try to do better next time, and sometimes you have to consider yourself, this resident, and other residents' safety in the moment. Families sometimes struggle with the same things that you might. For example, taking the expression personally or thinking the person is behaving in a certain way on purpose. It can be helpful to help families understand what might be and often is going on in the person's brain. It can also be helpful to ask family members what worked in the past when their family member was having behavioral expressions. So in summary, behavioral expressions are usually the result of an unmet need or want. People do not do behavioral expressions on purpose. There are many different types of behavioral expressions, and people with behavioral expressions deserve to be supported and treated with dignity. Acknowledge, affirm, redirect can be a useful intervention when dealing with behavioral expressions. Our third module will focus on how to prepare your shift for working with residents with dementia. There's always more to learn. Here are some references if you would like to dig a little deeper. It's time to test your knowledge. Follow the link on the Frontline Forces webpage or in the YouTube description of the Effective Interventions in Caring for Persons Who Have Behavioral Expressions quiz.